Good afternoon. My name is Dr. Ollie Jones. I am the co-president of the Ohio Grandparent Kinship Care Coalition, which is a statewide coalition supporting and strengthening and undergirding grandparents and other caregivers raising children because either someone else, their parents cannot or was not able to raise them. Today, we're here to talk about children and COVID vaccine. But before I introduce our speakers, I want to acknowledge Ron Browder, who's our board chair, and I'm not sure, Barb Turpin is our secretary, Lynn Stevens is our co-vice president, and Sean Jones is our treasurer. We ask that you also visit our website where you can look at previous Zoom meetings that we've had over the past year around various issues impacting grandparents and other kinship care providers. We're not going to prolong the time. As we go through the session today, if you have questions, you can please write them in the chat. Someone will be monitoring them, and at the end of the session, we will be able to have our speakers answer those questions. We have two speakers today, and we want to give each of them at least 30 minutes to present and then leave the rest of the time for questions and answers. We're here to talk about children going back to school and the impact of COVID. So information about the vaccine and other safety measures for children going back to school will also be discussed in this afternoon session. We have a beautiful, attractive, I'll make sure I pronounce her name right, Dr. Yolitha. She is a geriatric medicine specialist in Akron, Ohio, and has 13 years of experience in the medical field. She's a graduate from University of Cincinnati Medical Center Medical School in 2008. She is affiliated with Summa Health Systems Akron campus. She also has a fetal alcohol syndrome disorder family peer support specialist training. And so as you see, she comes with a wealth of knowledge and information that she is going to be bringing to us this afternoon. Our second presenter is Rachael Martin. Ms. Martin possessed 40 years of public service experience in the health care field, including coordination of healthcare systems nationally and internationally. Currently, she is the executive director of the National Alliance on Mental Illness of Franklin County. We want to welcome our speakers at this time. Turn it over to Dr. Yolitha.
Thank you very much for that introduction. Can you guys hear me okay? Give me a thumbs up. Thank you so much. I'm going to share my screen. All right. So today we're going to just discuss a little bit about COVID-19 and about the vaccine specifically, but I do a comprehensive discussion because I believe since we've been going through this for the last 18 months, it's extremely important that we kind of review some of the steps because I think that's where some of the misunderstanding comes in. All right, so we're going to talk about COVID-19. We're going to discuss the stats, the prevention measures, and the vaccine update. Within this discussion, we will also discuss children 12 and over. I'm going to move my little box out the way here. So COVID-19 is an infectious disease that we have all been living with so far since 2019 of December. It is caused by SARS-CoV-2, and this was known to be originated in Wuhan, China in December 2019. Previous to this, there was no information about COVID-19. However, historically, when you look at the shape and how COVID works, it does have some ancestors, right? And so we know that the oldest living ancestor started back in 3300 BC. And as you see, we've had a beta, a delta, a gamma, and an alpha. They almost sound like fraternities. So a little bit more about COVID-19. It can cause a plethora of symptoms, including tiredness, high fever, difficulty breathing, as well as a dry cough. It is extremely important that anyone that has any symptoms at all goes into get tested for COVID. As a physician that I still practice at least 25% of my time, I do see people who are waiting for symptoms such as the loss of taste in their mouth or just the productive cough, which never arrives, and they're still very much positive for COVID-19. And some even have said, well, I don't know of any positive exposures. But again, if you're going to the grocery store and you're living your day-to-day life, you may not know who has exposed you to COVID. So we know that we can get it through small particles, right? But we can also, it's aerosolized. So we can get it through just the air. If somebody sneezes, somebody talking, somebody coughing, especially if they're not wearing a mask. We know that these particles can actually, as far as travel, they can travel up to 3 feet. That's why we ask that individuals are at least 3 feet away from each other. But we also know that these particles can live on surfaces, which is why we often frequently ask that folks sanitize the surfaces with bleach or hand or some type of Lysol or some type of cleanser. So, but our biggest problem, as you guys probably know, right? One of our biggest problems is the asymptomatic people. There are a lot of people who are walking amongst us who are very much infected with COVID-19. And sometimes they, even if they are not totally what we call asymptomatic without symptoms, they might just have like a stuffy nose and may believe that it's just allergies or something else that may be going on, when again, they're actually walking around with COVID-19. This is really the large group of people who are spreading the disease to others. So why do I care? So these numbers are actually just from yesterday, and I try to update them as I do these discussions. But as we look at the United States cases, we know that it's 37 million, and we know that over 600,000 now individuals have died. And if you can just reflect on that for a second, again, I would say that there's been over 600,000 individuals that have died from COVID. And that number does not take into account individuals who delayed going to the hospital, right? Maybe they've had some chest pain, they just didn't go, or people who didn't go get their preventive care and they died early, or people who didn't get the proper mental health care. This slide is actually from Ohio. And I look at the death count again, because this is what we're trying to prevent with the vaccine. And we'll definitely talk about that on my second part here. So far, just in Ohio, we have almost 21,000 deaths now. And if you look at these age ranges and we break it down, they increase by age. And so you really start seeing it puff out there, 40, 49, 50, 59, 60, 70, 80s. Median age here in Ohio is 79. Again, I like to break these down in terms of the vaccinations. And so we know that a little over 50% have been vaccinated, has started their vaccination process. And we have those numbers being broken down, looking at each category. I would definitely say our 50 and over are doing the best here in terms of making sure that they get vaccinated. We still have a lot of work to do in those other categories. The 0 to 19 is low because if you will remember, as we will go over, that the Pfizer vaccine is the only vaccine that is approved for 12 and older, not younger. Even though there has been some folks trying to still get their kids vaccinated. So just a small reminder that this is a virus. Antibiotics do not work against the coronavirus. And so often, sometimes, I won't say often, but sometimes I get folks who still ask me for antibiotics for this. Again, protecting yourself and preventing the spread is still important. And I know we have the vaccine now, right? But we still need to wash our hands. And I always, when I do this, I always talk about how my grandmother taught me all of these things anyway. So, you know, the importance of washing your hands, and if you don't have soap and water, then you can use hand sanitizer. Social distancing, which is about 1 meter or 3 feet away. Try not to touch your eyes and nose. I know it's super hard, especially around allergy seasons. Cover your mouth with your elbow. This is something that I have had to go over countless amounts of times with some of my patients. And really pay attention to your body, right? If your chest is getting tight, you are short of breath, you're having a fever, don't discount it to something else. Go seek medical care and go get the COVID test. And nowadays, you can even get a rapid COVID. I actually stockpile, I shouldn't say stockpile, but I keep 5 COVID tests in my home at all times, because I know if somebody gets sick, they're going to turn to me and ask me what is going on. So I keep a COVID test, plus for my 3 children as well. So if you are sick, stay home, you know, continue to do all those other measures. But the biggest thing is going to be stay home and seek medical care if necessary. So this is the part 2 that I was speaking of about the vaccine. And this is when I want to go over this just a little bit in more detail. So back in December, one mid-December, and the other one came out at the end of December. So Pfizer came out first, and these were the studies in the New England Journal of Medicine with Polak and his group. And what they did was they tested the safety and how well each of the vaccines work. So it was Pfizer and Moderna. Moderna came out second. So I want to talk to you about how this all starts. So everybody wants to ask, how did it happen so fast? What is the process? So I want to go through the process because, again, one of my degrees is in pharmacokinetics. And I think it's very important that you guys have an understanding. So the preclinical trials, you guys might have seen some of this on TV, where they have like the small mice in the cages, and they're getting tested. They're testing on these small animals. And that's absolutely correct. They're first going to test on mice or whatever type of small animal, maybe guinea pigs. And they're going to test to make sure it's safe and it's not toxic. They're going to look at the immune response. What happens when they give the rat or the mouse the injection? That's preclinical. The first phase is they're going to enroll healthy adults. Not a whole lot, maybe a little fewer than 100. And then they're going to do that again once they figure out that it's not going to kill them. The second phase, they're just going to expand that. And they're going to say, not only do we want to make sure it's safe, but we want to make sure that not too many people get fevers or pneumonia or something else that could be potentially harmful. And phase 3 wants to make sure it does exactly what we say it does. This is the preclinical trial. And in this case, how did they shortcut this? Well, they didn't use mice. I could tell you that. They had to shortcut it a little bit. So they said, instead of using the mice, we're going to use a primate. So they used primates. And what they did was they gave it the COVID vaccine, and then it exposed the primate to COVID. And then they say, okay, it's safe. We know it's safe. It didn't kill the primate. So now we can then go to adults. So during this time, what they looked at is, once they did that in adults, they monitored for local and systemic adverse effects, okay? And they made sure that they wrote down every side effect that the individuals had. They did not stop at any process. They did not halt at any process. They continued to go through their typical exercises and protocols. And they were making sure that no one had any type of severe reaction. So by the time they got to phase 3, what they did for the Pfizer, they had 36,000 participants. This is a big trial. Imagine how many people you need to get into this trial. Those are some big numbers. And so these were just people in the population, 170 confirmed COVID-19 cases. And out of that, only 8 in the vaccine group had COVID and 162 in the placebo group. So I'm gonna kind of break that down again. So out of 170 confirmed cases of COVID, only 8 people who had the vaccine had COVID, but the people who did not have the vaccine, 162 caught COVID. And so they were able to do this with individuals who were 16 years and older. As we know, earlier this week that Pfizer was now approved for individuals also 12 to 15 years old. Later on that month, another study was published by Moderna, which was similar results, 196 confirmed COVID-19 cases. Okay, and out of that, only 11 in the placebo group had COVID, and 185 in the placebo group. So 11 and 185. The vaccine did what it was supposed to do. So how did this happen so fast, besides shortcutting using the primates and not halting unless there was a severe reaction? So I don't know if you guys remember early in 2000s, there was a couple of diseases called SARS-CoV-1. We just called it SARS back then because we didn't have a sequel to that like we do now, and MERS-CoV. So we had all of this data and we were finding treatment. We were trying to find a cure for this because it was killing folks in China and in Asia. So we were already developing a vaccine for this. And at the time where it just kind of dissipated, they did a shutdown in China and they did a shutdown in Singapore, and it kind of just went away by itself. And so now we have all of this data that we were able to build upon and use that data. And at the time we were able also, as we're developing these vaccines, to use technology at our fingertips. We're not writing letters and sending it by stagecoach anymore. We're doing these things in real time where we're able to Zoom with somebody halfway across the world. So a little bit about the Pfizer vaccine. It does lend partial protection, 52% at 2 weeks and 95% after the second dose. We know now that these vaccines are pretty safe. They've been out for approximately, I want to say almost a year now, 8 months now. There is some side effects that you have to be careful of, especially after that second dose. So what do we need to consider when we're giving out these vaccines, when we're making the rules about the vaccines, when we're making these policies? These policies are very important because we know that when we shut down society, it's not in a vacuum. Our businesses hurt, our children hurt because they're not going to school. And so we really have to balance this in a very sophisticated way. So we want to ensure safety and effectiveness of this vaccine. We want to reduce the transmission, morbidity, mortality of the disease, but we want to help minimize disruptions to society, its economy, and help maintain healthcare capacity. At this time, I can definitely say that we're starting to inch back into where people could not get elective surgeries like we did at the peak of the pandemic because there was such a oversaturation of COVID cases. So this is just a little bit about the ingredients about the Pfizer. And so this is just about, again, I kind of go a little bit over just co-administration of other vaccines, especially children sometimes are getting more than one vaccine. It's important that you give it a minimum of 14 days before you administer any other vaccine. Okay. I have some information about, this is all that you don't give it for post-prophylaxis. I can be very verbose sometimes. So the Moderna vaccine is just as efficacious, 94%. We talk a lot about the mRNA and spike protein. I'm not sure if everybody really knows what that is, but that does not alter your DNA. It does not go into your DNA. What it does is it shows your immune cells what it looks like. It's a stranger in your house, basically, and your immune system makes a copy of that, and so that when it sees it again, it attacks it. And that's why from the first shot to the second shot, your immune system goes crazy because it says, hey, I remember you. And last time you came here, you walked in my house without, you didn't knock, you didn't do anything. So the second time I'm going to attack you. I'm going to make sure that I decimate you. And that's why the immune system does that. And sometimes we'll have the headaches and the fevers after that second vaccine. I certainly did. And it lasted probably less than 24 hours. Very few contraindications. Of course, if there's any contraindications to any piece of the ingredients, again, just like you carry your groceries into the house in a grocery bag, there has to be a vehicle of the way for us to get the vaccine in you. If you're allergic to any of those byproducts, again, you definitely do not want to take the vaccine. And I take just a quick shot here of just the ingredients that are in that. So when can I get a booster? And so they're already talking about folks getting a booster. So what we know about the Moderna is that at 6 months, people are still have a pretty good response to it, 93%, which is extremely efficacious. But they know now that it would probably be good with the Pfizer for folks to get a booster at 8 months. There's also some argument for additional doses if you have a low immune system, such as if you've had chemotherapy in the past, or if you're on chronic steroids. Just a word about precautions, that if there is some fear about the particles that are in the COVID-19, you can get allergy tested with your allergist, and they'll be able to do that. So a couple Mythbusters. There's no microchips. I'm not magnetic. My husband and I are both physicians, and we both received the vaccine back in December. We have yet to be magnetic. There are no viral components or weakened form of the virus inside the vaccine. There's no evidence of infertility with this. Moving my box all around. Yeah. And it does not change, as I said before, interact with your DNA. And again, this will not change your test from negative to positive. It does not give you COVID, and it does not interfere with your menstruation. So again, people always say, well, you know, I've already had COVID, so why do I have to get the vaccine? Well, we know that you get better protection with the vaccine because you're just getting that much more of the actual, your body is looking at the actual antigen, or should I say the particle that induces that response in your body. Word about Delta. You guys have definitely probably heard about this Delta variant. It is extremely contagious. And right now it's the #1 variant in the United States. It spreads a lot faster. People who are vaccinated can and will spread it. So if I have the Delta variant, that although I'm vaccinated, I could spread it to somebody who's unvaccinated and potentially harm that individual. But we do know that the vaccine is still very effective at keeping folks out of the hospital. As a vaccinated person, the CDC and myself, I definitely recommend wearing masks even indoors. I have my mask here. I keep my door closed at my office. If somebody comes in, I throw my mask on again, you know, as a measure of just trying to keep myself safe from spreading it and keeping those safe around me. So our little people, all of the things that I have just said are true for our little folks too, our 12 years and older. Up until this time, 430 children US-wide have died of COVID, 430 under the age of 18. Out of that, 96 children are Black, which is about 22% of that. And 153 are Hispanic. So altogether, that's 58% of that number. Extremely important that we pay attention to making sure that our children, that we reflect on getting our children vaccinated. I know this is difficult. I know it's extremely difficult, but again, if they spread it, if we could go back to that slide that had the deaths on it, if they spread it, they're at risk of spreading it to somebody in that 60 and over category that is dying. Okay, so I say that again, kids get it, and there are 4.2 million cases that kids have. And they're not necessarily dying from it, but once they get it, they're spreading it to older adults. And again, potentially to hospitalize themselves, but definitely puts others at increased risk of hospitalization and death. So we want in-person learning. I just cannot say enough. I'm here in Akron, Ohio, and the children that did not get a chance to go to school last year, you definitely see that education gap. They lost a whole year. So we want the in-person learning. It is definitely a priority. But again, that if they're old enough to be vaccinated, get them vaccinated. Definitely should be wearing a mask at all times. And actually at this point, CDC is even recommending that even if they're vaccinated, to wear a mask, because you can still spread the Delta variant. Proper ventilation systems, regular cleaning. It's very hard to keep kids social distancing. My kiddos, you know, they think social distancing is just being an inch from my face, but you do the best you can. And making sure that if you can, layer all of these things, clean, wear the mask, hand washing, and social distancing. So these are my resources. I use the CDC. I use Johns Hopkins, that tracker. I just absolutely love that tracker. And I use also ohio.gov. I wanted to save a little bit of time for questions because I know that you guys may have some questions in regards to the vaccine.
Yes, Dr. Elodie, your presentation is very good and excellent in terms of breaking down that information that gets so confusing. So thank you very much for the way you've presented. My question is, we're talking about the Delta variant now, but what is the potential for other variants to come along in the future?
Oh, absolutely. That is a great question. Right now, for example, there's the Lambda variant that is in South America. And so we know that that Lambda variant, that the vaccine is ineffective to that Lambda variant. And so as US tourism still, I mean, there's a suitcase shortage in the United States, for crying out loud. And as we all continue to travel, I would say it'll be here before we know it. And so mutations happen in viruses every time it jumps from person to person. So rather it's a small mutation or a large mutation, by the time it works its way through an individual, it has already mutated. What the variant does is that it becomes a significant mutation, that it affects the way it affects hospitalizations and mortality.
In the case of what we're going through now with the Delta and the vaccines that we have existing, is it potential that these vaccines that we currently have will also address the issues of any new variants coming along?
So far, yes, I definitely feel that between the vaccines that we already have out and our boosters, they would be effective against any new variants. However, again, there is that Lambda that's out. Now, we don't know how fast it's going to progress, or even if it's going to come to United States, because as we know, we've had a couple of variants in the past, including the one from South Africa. We've had the UK variant that didn't make it very far. But again, we need to be very vigilant that it's a possibility that we may have to, I don't want to use the word go down on the lockdown, but if we have a variant, we may have to bunker down again until we see what it does.
Thank you. I'll ask another question then. What is the time frame for kids younger than 12 right now to possibly be able to get the vaccine?
So they were looking at September to come out with those guidelines. And this is my opinion now, so I'll try not to interject with that too much. I think there's a lot of anger out there amongst some folks when it already comes to vaccinations on adults, that they're feeling a little bit more pressure to be a little bit more slow with coming out with those requirements for children. For example, if you look at how long it was FDA approved, the thought with that was they just had to do, they wanted to take extra time so that folks felt a little bit more trust in the process. So the short answer to that is we're hoping October. But again, I think that now some of these pharmaceutical companies are at the point of responding to some of the critics out there.
Thank you.
Are there any other questions for the doctor before we go to our second presenter? If not, thank you so very much for that wealth of information and knowledge that we need as we move throughout this year and next year dealing with COVID. Thank you so much. Now we're going to go to our next speaker, Ms. Rachael Martin.
Good afternoon. My name is Rachael Martin, and I'm the, no problem, Ms. Jones, it's no problem. I am the Executive Director of the National Alliance on Mental Illness of Franklin County. So before I get started with what I want to say and why I am here, I want to tell you just a little bit about NAMI Franklin County, because I'm not sure how many of you on the line know about NAMI. Our mission, NAMI's mission, is we are dedicated to providing support for families. We are dedicated to improving the lives of families that are living with a mental illness and their relatives, their families, their friends, and we do it through a number of ways. We do it through support, outreach, advocacy, referral, and those are the ways in which we provide services. Now, in the United States, there are 600 NAMIs across the country. And in Ohio, there are 40 affiliates, and NAMI Ohio is our parent organization. And the kinds of services that we provide are, we have classes that are designed for families who are living with a mental illness and they need help, guidance, and support. And we teach these classes. Right now, they are on Zoom, but the things that the families learn about are such things as this. They learn about the different types of mental illnesses that there are. They learn about the prescription drugs that are associated with the mental illnesses. And they learn about how to take care of themselves as they go through this difficult ordeal. They learn the different referrals or the different agencies that are in their county that can help them as they go through this journey. We also teach classes for people who are living with a mental illness, and they also learn the same types of things, but the only difference is they learn about an advance directive, which means that when I am in a crisis and I'm not able to function properly, that you have, the family member has the right to help sign off for me during this crisis. Also, we provide classes for parents who have a young child who is living with a mental illness. And they learn specifically the same things, but the only difference is that they learn about IEPs, 404s, helping with the school situation. We have support groups that are designed for people, for family members who have a young family, someone who is living with a mental illness. Right now we have 8 of those. And I facilitate 3 of those support groups. We have support groups for people living with a mental illness. And we have 3 of those right now. We have support groups for parents who have a little child who is living with a mental illness and they don't know what to do. We provide a program called Ending the Silence that is in the schools, and we teach kids about mental illness because right now they are in a tough place and we need to be able to help them and provide them with some care. Those are some of the things that NAMI Franklin County does. So I am here to talk with you about the Family Peer Support Specialist. This is a training, and we hope that a number of you may be interested and will reach out to me about the family peer support specialists. Let me give you a little bit of background about them. It is a position of training that is taught by NAMI, Ohio. And what it does is, and who is a family peer support specialist is this. It is a legal caregiver, a parent, a guardian, a relative, a permanent, who has permanent custody of a child with a behavioral challenge. It is an experience in navigating the system of care in Ohio for at least 1 year. So this person has the ability to get the care that they need for their child who has a behavioral health care issue. The person partners with families, youth, professionals, and other community members to plan and implement services. It supports families' strengths in problem solving and solution seeking, knowledgeable of the community resources. It accepts direction, guidance, and assignments made by supervisors and a treatment team. The new name for the family peer support specialist is called the Family Peer Supporters. Now, the training that I am talking about will occur in November the 15th through the 16th. The person will actually come here. They will be put up in a hotel at the Embassy Suites at the airport, and we'll go through the training for 3 days. We will pay all expenses. Then on the 29th and 30th of November, the training will be done by Zoom. All meals will be paid for throughout the training. So let me give you just a little bit more information about the training. Now, the training will ensure that those employed in Ohio as family peer support specialists meets the high standard of performance. Create a uniformity of core competencies of practitioners. Ensures professional development, continued education, and supervision. Advances uniform standards, a scope of practice, and best practice. It promotes ethical practices within the profession. It encourages cultural diversity, cultural competency within families and professional partnerships. It instills confidence with families served. Now, the Family Peer Support Specialist offers emotional connection of people who have been there. Informational and educational support for systems and strategies. It assists families as they develop positive approaches and methods of addressing their families' day-to-day needs, including their own needs for self-care. And last but not least, it gives concrete provisions such as helping arrange childcare, transportation, finding housing, etc. Hope as families look to the future in a realistic way. So this opportunity is available to you. And we are hoping that you will take advantage of it. And I would like to provide to you my cell phone number, my email address, just in case you are interested, or if you need more information about it, please feel free to call me. My cell phone number is area code 614-266-6709. And my email address is Rachael, RACHELLE at NAMI, NAMI, F as in Frank, C as in cat.org. And we hope that you will take advantage of it. At the end of the training, you will receive a certificate of completion, and then you may go on with the process of becoming a certified family peer support specialist in the state of Ohio, with the idea of NAMI Franklin County helping you to find a position in some state, in some area in Ohio. So if you have questions, please feel free to ask me. And thank you for the opportunity.
Thank you for that wealth of information. Are there any questions for Ms. Martin? Any comments?
So Rachael, in terms of NAMI and its services, if grandparents or relatives who are working with their grandchildren or caring for their grandchildren and are struggling with particularly those children who have been exposed to trauma, how would they reach out to you to see what NAMI could do for them, and what would NAMI do? Direct them to some of your colleagues who do that type of work, or would NAMI do it itself?
Okay, that's a great question, Ron. Thank you. So what we would do is we have a set of very competent women who are specialists who work with helping parents get their needs met and work with them with finding the appropriate facility that they can go to get their children or grandchildren the services that they need. And so we would refer them to our family peer support specialists, because we actually have 4 of them that are very competent individuals that can get them started with what they need to help them with their loved one, with their little kiddos. Does that answer your question?
Yes, and so I'm assuming that if the grandparent, because as we know, grandparents and other relatives who may be caring for their grandchildren may also have some issues going on, since they had not necessarily intended to be raising grandchildren at that stage of their life, may also be experiencing some things. So they also could approach NAMI, and NAMI would be able to assist them. And the second part of the question, Rachael, is that in terms of culturally competent services, because we always wanted to make sure, particularly for people of color, and whether it's people of color, whether it's our Latino colleagues, or whether our Asian colleagues, Native Americans, and then even our Appalachian families, that NAMI is able to direct them to people who would understand and be able to service them culturally appropriately, right?
Absolutely. We have a Hispanic support group, and we have historically worked with the Asian community to get them what they need. And of course, we work with the African American community. And now we are beginning to have a relationship with the Bhutanese Nepali community as well.
Thank you.
Thank you.
Thank you for the excellent information, Ms. Martin. I know you're saying the peer support is a statewide initiative, But are there NAMI offices in all of the counties, or are you regional? How do other counties outside of Franklin County access the services?
So there are NAMIs all across the state. There are 40 of them. And if anyone needs to have that information, I have all 40 locations that I can refer people to. And if I don't know the answer, I can get you to NAMI Ohio, and they can help with that information as well.
Thank you.
Thank you.
Any other questions? I know COVID has really impacted a lot of families and individuals around mental health challenges. This past year, myself being a clinical therapist, I definitely can relate to what you're saying in terms of the need is great to have culturally aware and culturally sensitive individuals to provide those services. So thank you for that wealth of information. We truly appreciate it. Are there any other questions? If there aren't any questions, I want to give it to Ron Browder, our board chair, and see if there's anything that he want to add before we close out.
No, not at this point, Dr. Jones. I would just share, Barbara might be able to talk about what we're going to be doing in our upcoming webinars. I know that we've got some exciting and interesting information that will be coming forward in September, October, and November. And I did want to remind people, I know it's rather early to be thinking about it in August, but we will be once again having our Christmas celebration for families who are engaged in kinship. And also at that meeting in December, we will have the annual meeting. So I did want people to know that. And so we'll get the word out. But Barbara, I don't know if you want to talk about September, October, and November or not.
Well, I know that Dr. Jones has reached out to Dr. McDaniel and her program that is in, is it Pennsylvania?
Pittsburgh, yes.
Pittsburgh.
Yes.
Has reached out to Dr. McDaniel to do a presentation about her program called Second Chance in Pittsburgh, and they're in communication right now in terms of how that is going to be arranged. But we are looking forward to a presentation about the program in Pittsburgh. It's a kinship program that's been around for years, and she's a very well-known kinship advocate, and we look forward to having a presentation about what they've done in Pittsburgh with their kinship program. In October, we had to reschedule the internet security Zoom meeting that was previously scheduled for earlier this year. And so that's back on our schedule. And so it will be a presentation by individual from Cleveland who is very well versed in internet security, especially around, with kids and their activities on the internet and how to maintain your security and their safety. So that also is going to be very interesting and pertinent information, especially right now when everybody is using the internet and Zoom and all of these technologies to communicate. November, Dr. Jones, maybe you want to speak a little bit to the arrangements that you're working on for presentation on the with your contact.
In November, we have a young man by the name of Lewis Fields, who is currently incarcerated at Grafton Correctional. He has been very active, involved from the inside out, impacting the community, Books for Bruises. I am pleased to say that he went a second time up for parole, and he has been granted parole, and he will be coming home to the Youngstown area October the 11th. And so he will be out to really be more involved with that process. But he has been very instrumental in developing a monthly Zoom. The one he did was the impact of trauma on children who have been impacted by parents incarceration. He was able to get 2 very well-known psychologists out of Boston to do that. So he'll be home to help facilitate the one in November.
Oh, good for him. And then December's meeting, it will be earlier in the month, around the 8th. I believe we've scheduled that just because we want to have sort of a holiday celebration and recognition of caregivers for that month for the holidays. And we are looking at possibly having some gift cards to raffle off during that or to give away during that meeting, and just, you know, talk about what's going on in the holidays, that kind of thing. We also want to recognize September coming up is Grandparent Kinship Caregiver Month. We have gone in with a number of other organizations to request a proclamation from the governor, and that should be coming down pretty soon. We'll post that on our website as well as any other information about the upcoming meetings, and I will be sending out invitations ahead of time to let people know. So we have a very full calendar for the rest of the year, and everybody stay safe.
You're on it. Thanks, Barb. I was just getting ready to ask about that.
I know, Patrick, some of us been around for a while, have that expectation. So it's being worked on, and hopefully it'll be out there for people to look at and see the recognition for our caregivers, which deserve so much more than a month, but we'll take what we can get.
Right. Is there anything else for the good of the order? And we're asking the officers to stay on for about 10 minutes after we, the rest of the folks zoom off. Any other comments or questions before we let you go? If not, thank you to our speakers, did an awesome job. We thank you so very much for that wealth of information. We'll see you next month. Have a great rest of the day.